I'm Michaela Torraca. I'm an occupational therapist here at the Hanover Outpatient Clinic. Specialize in neuro rehab. Depending on the severity of the stroke, there's typically an expected timeline of recovery. The first 6 months to a year where the most progress is likely going to come back, but everybody is different. The principles of neuroplasticity and the way the brain can change over time have shown us that people can continue to make progress for years and years after their stroke. Episodic plans of care are these time-limited plans of care where we see a patient for maybe 4 to 6 months at a time, or longer or shorter than that. Typically, if it's right after their injury or their stroke happened, it's going to be probably a longer plan of care because that's where we're trying to maximize their recovery. Episodic plans of care are important because we know that neurorehabilitation, especially from a stroke, is a long, multifaceted process that has lots of parts to it. But it helps us sort of build these blocks of time where we have these specific goals that we're working toward, and then once those goals are accomplished or the progress is sort of maybe slowing down a little bit or plateauing, sometimes we get to a point where we might be doing things that you could potentially be doing by yourself or with a caregiver at home. Then we can work towards a discharge and then let the patient work on those things at home and then come back for further plans of care. After that, we're working with them to establish a home exercise program, a good routine at home, so they can sort of feel comfortable discharging, working on things at home, and then potentially returning in the future for another plan of care where we can reassess their progress, see if they're appropriate to come back for more therapy. Typically, we do see the best outcomes with episodic plans of care in the patients that are compliant with their exercises, they do their gym programs, or they work with their caregivers to make sure that they're maintaining their level of function so that when they come back for therapy, we're able to capitalize on those gains and go even further. We have to be able to justify that your therapy is medically necessary and skilled. So in terms of coming back for another episode of care, we would recommend seeing your doctor first, probably to see if they're in agreement with that. And they can write you a new order or a referral for therapy, which would allow us to complete a new evaluation and see if that patient is appropriate for more therapy.